So finally, I said enough, and then the doctors said no. They sent 4 or 5 people in to talk to me, which took several hours, and each one would try to convince me not to take him out of the hospital. And to each one of them, I would shriek, "You can't fix him. You might, out of some miracle, be able to reverse all of the damage you did to his lungs and his gut, but you can't fix his skin. After all that, he will still be missing half of his skin. What the hell are you going to do about that?" One supremely stupid resident said to me that I hadn't even begun to fight. I screamed at him that we had been fighting since the day he was born. At least in my head it was a scream. These days I'm not really sure what happened. Then they threatened me with an ethics committee. They were going to have me go up against an ethics committee because they were so arrogant that they thought that if I would only let them, they could fix him. There was no ethics committee, and eventually they did let him go home, where he died the next day. So I wish I had had Dr. Bruckner's paper to protect me and Ethan before, but I'm grateful for it now. I chose this excerpt from my book because I thought that it would be the most helpful for those treating EB children as an insight to how the parents feel about the doctors and surrounding medical professionals. I saw a YouTube video recently from a medical student who was giving a presentation and mirrored my thoughts, so I thought that I would share some of her insights here. The study she focused on was of 22 children that had the junctional Hurlitz subtype of EB in the Netherlands in the past 23 years. Her major points were these. Average life expectancy is 6 months. Factors such as hypergranulation, blisters at birth, length of gestation, GB3 antibody levels, and invasive treatments such as blood transfusions, gastrotomies, and intubation had absolutely no effect on life expectancy. Initial weight gain after birth was the only predicting value of how long the babies would live. Treatment for junctional Hurlitz babies should focus on palliative or comfort care. These include pain management, wound care, and laxatives. Most patients who die of this lethal subtype of EB do so because of failure to thrive. The remainder succumb to sepsis, respiratory failure, and pneumonia. The point of this presentation is this. Avoidance of invasive medical treatments is the best care that we can give to patients with this type of EB. Medical treatments are burdensome and harmful and do not prolong life. Our goal should be to be honest with the parents of these children about their diagnosis and prognosis and focus on the comfort of the patient. We have to at some point stop focusing on maintaining life, but instead focus on what is best for the patient, which is in some cases to lessen their suffering by letting them go, instead of imposing more useless and painful medical procedures on them. Thank you for your time.